A stroke is basically when there's a particular area of the brain that's not receiving the right amount of oxygen via the blood, and that can be either from a blockage or from some sort of a hemorrhage. When a person has a stroke, usually the symptoms are sudden. So it can be anything from numbness or weakness on one side of your face, arm, leg, or it might be something real subtle where your vision isn't quite right, you don't have the ability to speak the way you could and should, or even balance issues. Any of those things that come on suddenly put you at risk for stroke. Basically, if you have risk factors for heart attack, then you have risk for stroke. As a matter of fact, if you have heart disease, then there's twice the chance that you could have a stroke. And so some of those risk factors that you have to think about would be good cholesterol, bad cholesterol, high blood pressure, diabetes, obesity, inactivity, irregular heartbeats, or heart rhythms, I should say. All of those things are risk factors that put you at stroke risk. Time is of the essence. If you have stroke symptoms, we basically have 4.5 hours to do something. And if you don't come in right away, then you cannot benefit from the medical treatments available, such as clot busters and other interventional tools that we have in the healthcare field. Disabilities, first off, like I say, it could be anything from not being able to use an arm or a leg, or inability to speak, visual problems. But if you don't act upon the symptoms that look like a stroke, then you can have long-term deficits.